I am very happy and pleased to introduce, very briefly, Dr. Melanie, Noel, and Joletta Belton. So these are two wonderful people in the pain community who you haven't already heard of them. You're going to just absolutely enjoy and grow by learning and hearing from them today. Part of their session today, which keeps flashing up, so I don't know, I can't read you the exact title, but they're going to tell you a little bit more about themselves as we move through the session. So I'd like to please welcome Melanie and Joletta.
Okay. Can everyone hear us? Is the mic on? Yeah? Can you hear? It's usually not a problem for me. We're going to let the tech people figure out how to project onto the screen. Ooh, it's okay. Let's just let them do. Let's let them do this. Yeah? Let's have some. Thank you for coming. I see some familiar faces here. And you signed up for this workshop, so you must be interested in it. And I'm curious why you're here and why you're interested. And I assume most of you, raise your hand if you're a clinician. Raise your hand if you're not a clinician. Okay, so?
I'm a strength and conditioning coach in Maryland.
Okay, condition.
Strength and conditioning coach,
Yeah, cool, and?
Similar to him.
Okay,
Strength and
cool.
conditioning coach, I'm a teacher coach.
Yeah, and you're all here because A, it's amazing, it's so much fun, but also you're working with people with pain. Who works with kids? Yeah, a bit rarer. So this is not geared to only, I'm a pediatric psychologist. This is not geared only to child people. So this is anyone who works with anyone in pain. While our friend is getting this hooked up.
I think it's your laptop. Are you able to put it on a flash drive for me? And I can
Sure.
from my computer.
Yeah.
Let me grab it.
Yeah. Okay, so I'm a pediatric psychologist, a professor. I do mostly research, but I work in the area of trauma and pain. Anyone see trauma in their practice? Yeah. Do you ask about trauma? And not just physical trauma, like emotional kinds of traumas, yeah. So I do work with veteran populations. I'm really interested in how pain kind of travels through generations, right? And how to break those cycles. I met Joe here, how many years ago? 4?
20, I think it was right before the pandemic. 2020,
Yeah.
4 years ago.
Yeah. And I bring this up to say, so I was giving my first talk here. I was thinking, why do they want to listen to me? I work with kids, and it's been such an amazing community. I was talking about my research. So at that time, I was doing a lot of research.
It was me, I think. Sorry.
We're going to get into our group. This is also going to be very interactive, by the way. So this is not us talking at you. The second half of this is all us doing and role-playing and practicing. But the reason, the biggest thing I remember about meeting Joe and you and Keith Meldrum, does anyone at that San Diego Pain Summit? Yeah. That was so powerful for me and ties to what we're going to talk about today. Because Joe and our friend Keith Meldrum were sharing their stories very bravely of their pain journey. And our friend Keith shared how he was in a very, very tragic car accident when he was 16 and almost died. And, we're sitting in the audience, we're listening to him, whoever was there, and it's available too online. I really highly recommend you listen to it. And, he lived with chronic pain, still does, for decades and decades and decades. And he had how many surgeries? 20, 30 surgeries, opening them up. He described it this way: opening them up, closing them up, opening them up, doctor to doctor to doctor. And the turning point in his life was one clinical encounter. And I think he only saw this person once with a clinician at this neurostimulation clinic. And he describes when the physician, looked at him. Here we go, it's working, yay. Woo! I'm trying to act like I'm not anxious, but like that's not working. Okay, I am, and I can't pay attention. It's so good. It's triumphant. But he describes this. I'm gonna walk a lot, so the turning point in his life, right? And he had like a near-death experience. Was a clinician who put down his pen, right? Put down everything, turned to him, and said, "I believe you." Now, we talk a lot in the pain field about just tell them you believe them, right? Like, it's kind of really, like, that's not enough. But this person authentically dropped everything he was doing, looked at him, and he knew he believed him. And that changed his entire life, right? So if there was a name of this talk, it would be, I believe you. But we're going to get into the nuance of what is validation? What is validation? Has anyone in their training, we're all clinicians, I'm a psychologist, I see Tim here. Any psychologists? Yeah. You guys are mostly manual therapists, is that true? Physios? Yeah? No?
Occupational therapist.
OT? Beautiful. Other professions?
Exercise physiologist.
Exercise physiologist?
Massage therapy and yoga.
Nice.
Nurse.
Nurse.
I'm going to drop mine in the hat. I run an organization that runs for peer support, so we hear this all the time and how to facilitate these conversations. So it's a little different than rest.
And if it's okay, like I want to start with something a little, we're going to go a bit rogue. It's in an interactive workshop. We don't have to be standardized. I want to share something with you to show you how pervasive this is. So we're going to talk about validation in a clinical encounter, okay? But this pervades society. And I will tell you, as a researcher, I have no idea what it is about pain that people don't believe. It should be the great unifier, right? And yet there's something about it, more than sadness, more than fear, more than any other experience, where societally we don't believe it. So let's take a pause and tell us who we are. That would be helpful. So I'm a psychologist. I'm a single mom of 3 kids. One of them lives with chronic pain. They're 10. So this is where life imitates art a little bit. I do clinical work, so I work in the area of trauma and pain, but mostly I work with people like Joe and other researchers to answer questions. But if I'm honest, the biggest thing I'm interested right now is in why, when, and for whom does empathy fail? Validation is how we communicate to another person, right? Our humanity. And the people that come to us have not received that out in society. So as a researcher, I look at how pain is portrayed in cartoons and movies, and we're not seeing empathy. And yet we are born with it, right? It develops. 2-year-olds. Where's Sarah? Where's your little guy? Where's your little guy?
He's running around.
He has empathy, right? You see this. Anyone have kids? Right? You see this. We care about people, and somehow it's lost in society. So that's something that I attached up. Oh, so it's like a family reunion. So nice. Ooh. It's not looking like
It's not on.
what do you want me to do? We're just gonna. So, okay, so that's my lens. This, it's gonna happen. This San Diego Pain Summit, when Keith shared his story and that moment of the pen, that is sort of the impetus for all of this work. So how can we be that person? And how can I convince you that one clinical encounter, one moment, could change the course of a person's life? We're just going to roll with this, guys. I bet you it's causing anxiety in you, like watching.
More that the people online can't hear.
Is it okay? We're good now?
Is that good, Matt? Keep talking.
Hello. Hi, good, good. Okay, we're gonna keep talking? Okay. Okay, good, excellent. Whew. Whew. That one clinical encounter. So I want Joe to introduce, I want you to introduce yourself too. But it was your talk with Keith and your experience. And it was the COVID pandemic where all these inequities, all this suffering. Guys, parents are 4 times as struggling as they were in 2019, right? Like we've got a mental health crisis on our hands. Probably we can all join the club. And that intersects with the pain crisis. We need each other, right? And, you know, we can do all the things and we can learn about all the interventions. If people don't believe that you believe them, if we aren't the change to change the course of someone's life, like Virginia said, like this is what everyone says. No one believed me. And isn't it amazing that one encounter could rewrite and change the course of an entire trajectory? To me, this is so empowering. And I'm a psychologist. I was never trained how to validate people. I didn't really know what it was. Has anyone else learned this in their training? How to validate? Well, you're better than us, right? So this is what we're going to talk about today. What is validation? Why does it matter, right? You can have all the interventions, but that will mean nothing if we don't get this part right. So I'm so excited to learn from the people that learned this, right? And to help each other and to kind of go out into the world. The second half of this workshop is all hands-on. We're going to do this together. Some brave people are going to come on the stage and we're going to role play this and we're going to do it. And we're going to fail and we're going to fumble. And that's okay, right? But I will tell you, I watch videotapes of clinical encounters and you can see where this goes wrong. And these physicians are not bad people. But there's so many opportunities to validate and to show humanity and to rewrite. And that's what I want to talk about today. How do we harness those? How do we listen for them? How do we respond and show up? How do we become? Who do you want to be in your patient's or your client's story? The hero, the villain, right? Go ahead, Joe. Who are you?
So, hello everyone. Am I good? Mic-wise? All these tech issues are making me anxious, even more so than normal. I'm Joletta Belton, and if you've been coming to the San Diego Pain Summit, you probably know a bit of my story and have met me here before. I'm someone that comes to this work through having negative experiences in healthcare systems, and particularly the workers' compensation system. I was a firefighter paramedic when I got hurt, and it wasn't much of anything at the time, and then became this kind of ongoing pain issue that ultimately led to my medical retirement. And I was in a system that was very adversarial, where I felt like I had to prove my pain over and over and over again. And in that having to prove my pain over and over and over again, it's like you have to prove just your worthiness as a human being. And that is so demoralizing and so dehumanizing. That system itself was so dehumanizing. I'm sure all of you have heard stories from people that have come to you for their pain, that you maybe were the first clinician who ever listened to them, or the first one who made them feel that they were heard or believed or validated. And that's some of what we're going to talk to today, because it's something I think gets glossed over too much when we're talking about pain and pain encounters, or we're talking about pain education for patients. The part that gets missed oftentimes is that connection with that person in pain, understanding them as a person, or getting to know them as a person, so that you can better understand their world, not just their pain. Michael and I were talking about this yesterday. If you haven't met Michael, you're going to meet him in the next workshop, about the worst years of our pain experiences, it wasn't the pain, like the symptoms so much that made everything so difficult. It was the context around it that made everything so much more difficult. It's the distress around it that made things so much more difficult. Those societal factors that we do a really crappy job of talking about in the pain world in general. We say biopsychosocial, but we're really focused still on the bio. Sometimes we focus on the psychological, but we rarely actually look at those social factors and relationships and the clinical relationship and how that can influence someone's pain experience. Being in those adversarial systems, and it's not just workers' compensation that can be adversarial, it could just be health systems in general that could be adversarial for that patient. And people have to advocate for themselves when they're least capable of doing so, when they're in pain, when they're ill, when they're injured. They have to advocate for themselves just to get, adequate care. Not even great care, just adequate care. And it's a crappy system for all of us. So what we're going to talk about today, this notion of validation that often gets glossed over when we're talking about the clinical encounter and that relationship between the person in pain and the clinician, and all of those opportunities to show someone that you believe in them, that you believe the story that they're telling you, that you believe that they're in pain, that their pain is real. Being able to convey that to them can be so meaningful for a person, because for so long I felt like my pain wasn't real or wasn't legitimized because it couldn't be seen on a scan. Like it couldn't be seen on an x-ray. I had surgery. After my surgery, I was anatomically fixed, so I shouldn't still have pain according to those biomedical boxes that I was supposed to fit in. And so then when you don't fit into those boxes, you're kind of left on your own, swimming out there in the ether, just looking for that one person who will help you to make sense of things, that one person who will believe you and legitimize your pain, make you feel seen and heard and acknowledged. No, just someone to acknowledge the suck of all of those years of suffering is huge. Because it does suck. Just having someone be like, man, that sucks, can lift a weight off of your shoulders. And that notion of like Keith's story of being believed. He talks about how he was checked out in that encounter because he had told his story so many times to different clinicians over and over and over again. And it didn't ever really make a difference. What he said didn't matter. It was still the checklist that was followed, or the file that was being written into, or the screen that was being typed into. So when that doctor took that moment to pause and say, don't worry, we believe you, like that's a profound moment for people, and everyone can be that for somebody. And it doesn't just have to be the clients or the patients that come and see you for their pain. It could be family members, it can be friends, it could be coworkers, people whose pain has been delegitimized in their day-to-day life. You can be that for so many people. Your kids, we're going to talk about some of that later. But so I came to this work, and now I do patient partner work like with Mel and her lab and with other researchers. So coming at it now from more of a researcher perspective, trying to understand these things, but came to it all through my own lived experiences of feeling invalidated, not always by individuals, but by that system that we're all in. That's incredibly invalidating for all of us, whether you're a patient or a clinician. It's not a very supportive system for any of us. So how do we work to change that?
Mm-hmm. I want to share something with you. I see Virginia McIntyre, and it really is a family reunion. Are you feeling it? Does anyone not know someone in the room? Well, you're going to be our best friends. Okay, don't you worry. You're going to be our best friends. And this is such a friendly group. This is so cool. I'm so excited to be here. And Joe, with you, my best friend. And I mean that. I want to share something with you. The reason I brought up Virginia, so we did this May Day fellowship. So it's an advocacy fellowship, learning how to talk about pain to people in society, right? Get people to care. Why don't people care about pain? What could be more universal and important, right? And yet, don't you feel like sometimes that you're just trying to prove to people that this is important? It's wild. But anyway, as part of this advocacy fellowship, we had to think about our work in a different way. And the easiest thing for me to do would be to write an op-ed about a memory reframing intervention to make pain better and needles are okay and la 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 la. That's important, sure. But instead, I started thinking about this and Keith's story and not being believed. And you know, the reason I got into this whole area was because we were looking at how parents would talk to their preschoolers, okay? Your little guy. We love babies at conferences. So we'd just get them in a room and we'd say, talk about something painful that happened. So this could be like falling down on their bike or hurting, whatever, anything. And we just said, just reminisce about it, talk about it. We recorded it and we left the room and we listened to it. And then we said, now talk about something sad that happened. Could be grandma dying. It could be a dog running away. It could be anything. And when we looked at the same parent, how they talked to the same kid about pain versus something even traumatic, they didn't know what to say, right? Why is it that pain robs us of language? It makes us freeze. With a loving mother and a child, right? So that got me really interested in sociologically, what is it about pain? So I want to share with you something I wrote. I'd like it to be a slam poem at some point, but it's not there yet. I'm workshopping it. But there's a reason. I'm not going to tell you the reason. I'm not going to preface it with the reason. You'll see. We're going to talk about validation in the clinical encounter. That's really important. But what Joe said is, this is about how we show up in society to our children, right? To other people in our worlds, okay? The culture of pain is making our children and our world sick. I'm a single mother of triplets with a zany academic job. Sometimes it feels impossible. Needless to say, the TV is sometimes my friend. The other night, I walked in while Georgia, Jasper, and Soleil were watching TV, and I noticed scene after scene of their favorite character being hurt, and all the other characters laughing at them. Slapstick comedy. I get it. It's what I grew up on. Bugs Bunny. It's what my 78-year-old dad grew up on. But this time I stopped. Is it just a funny Saturday morning cartoon moment? Or are these cartoons a temperature check on something much more serious? Why don't people care about people in pain? Why don't people care about children in pain? When Soleil was 2, she had empathy. All kids do. It's natural. It's automatic. Like when her brother Jasper would get hospitalized, when he got hurt, you could just see it in her face. She'd offer a kiss, the boo-boo better, even before she could say the word pain. Evolution gave us empathy. Humans survived because of it. So did animals. Mice show empathy when their neighbor mouse in the next cage gets hurt. Our brains instantly light up when we're even shown pictures of someone in pain. Yet every single person I've ever met with chronic pain says the same thing. No one believed me. Soleil is 9 now. Last January, she had an ear infection. The doctor told her she was fine. She went on to have excruciating ear pain for 6 more days. Everyone told her she was fine. If that isn't gaslighting, what is? She finally got a medicine. The infection went away. 9 months later, she tells me her ear hurts every single day. Soleil has chronic pain. We've been to doctors, the tests are normal. The pain isn't going away. This is where life imitates art. I'm a world expert on pediatric pain and make it my life mission to have people to just care about and believe that pain is real. I'm not alone. Why is this so hard? Last weekend, when I was aching in my bones, tired, trying to get dinner on the table, and George had to choir practice, and Jasper to Cubs, a juggle that at times makes me dizzy. So Leia told me her ear hurt. And for a moment, I didn't believe her. Her pain was and still is real. Chronic pain in kids can kill. It can lead to suicide, mental health disorders, opioid misuse, chronic pain into adulthood. And if it isn't addressed, it's likely to get passed down to their children and their children's children. And we still don't believe them, or we don't tell them that we do. As they get older, they quickly learn this. Parents don't know how to talk to their kids about pain. And yet somehow, talking about scary and traumatic things rolls off our tongues. Pain robs people of words. Children in pain suffer in silence. I tell you this because we desperately need to raise a generation of kids who care about humanity, war, unrest, climate crisis, and each other. And we need this now. The culture of pain is making children sick. It's robbing their empathy for others, the empathy they have when they're 2 years old. We need to believe them. They need to see other people being believed when they're in pain. At home, at school, at their doctor, in their Saturday morning cartoons. If no one cares about their pain, why would they care about other people? Why would they care about the world? They're watching, they're learning. I share that with you to show that what we're talking about today is not just how we show up in the clinic. You can have a massive influence on a person's life, but this is the stuff, this is about being a human and showing our humanity. This is how this connects to the broader issues in the world, you know? So I gotta work on the slam poetry, but.
I love it.
Thanks. So I teach not only clinicians how to validate, and that's what we're gonna do today. We're gonna talk about why this is not just a technique to then seg into your intervention, that this is an intervention and can be life-changing in and of itself. Does everyone believe that? Is it too much? Do you believe, have you seen that? Have you seen that a single encounter can do that, right? So to me, this is so powerful. It's all I want to think about. It's all I want to do, right? And this is also intersectional. Who is more likely to be invalidated? Any guesses? Women?
Minorities.
Minorities. Yeah? What about people with developmental disabilities? Completely, like that's another soapbox, like anti-ableism, hello, we need it in pain. Right, so the more marginalized someone is, the less likely they are to be believed, right? So this is happening in school, it's happening in families. I share that, it's embarrassing to say that, but there's something that we are sort of indoctrinated to not believe people, which is crazy. I think I've beaten this over the head. I'd like to, Joe, if you can share how this is a justice issue.
So one of the tracks that my own interest have taken since becoming this accidental patient partner, pain advocate, is the ways of knowing pain that we legitimize within the field of pain research or clinical training or health professional training when you're in school. And there's the evidence hierarchy. Has everyone seen that? The pyramid, where it's, clinical opinion or expert opinions at the bottom, and then the very top is those meta-analyses and systematic reviews and those sorts of things. And within that pyramid, everything gets more and more objective. Supposedly there's less and less bias the higher up on that pyramid that you go. But what's missing from that pyramid altogether are the people with pain and their experiences and their lived ways of knowing pain and their lived knowledge of pain or whatever health condition they're living with. So we're not a part of that evidence hierarchy at all. And that's a form of injustice related to knowledge, that our ways of knowing pain or our way of knowing pain doesn't matter. It's discredited or trivialized in what everyone is taught. So it's no wonder that people don't believe us when we're not even in the pyramid, that people are told this is what matters when it comes to learning about pain. So that discrediting of our ways of knowing pain is called testimony. Well, it could be two forms of epistemic injustice. There's hermeneutic injustice, which is related to how do we understand pain at all? You know, and if someone's pain experience doesn't fit into the box that we understand pain to be, and we very much objectify pain, it has to be seen to be made real. There has to be an objective test for this person's pain to be proved real. If that person's pain doesn't fit into that box, then where does that person's pain go? Or where does the belief of that person go? Most oftentimes that person then is not believed. And then they have no resources to draw from. They have no support because their way of living this pain or their way of knowing pain is discredited or delegitimized because it doesn't fit with what we've been taught pain is. I don't know if I'm saying that very clearly. And then this takes place in the clinic too. Then a story that I was going to share tomorrow, but maybe I'll share it twice. When I was a paramedic, I was a firefighter paramedic. When I was in paramedic school in 2008, so not that long ago in the grand scheme of things, we were explicitly taught that fibromyalgia was not real. We were taught this. In my paramedic class of 30, 29 men and me, the single female in the room, and taught by a man, we were told that fibromyalgia was a made-up disease of women seeking attention. We were taught that as emergency responders. So as much as I tried to be a compassionate medic, a good medic, I know that learning that in my schooling affected the way I believed people when they told me they had chronic pain or widespread pain or unexplained pain. I mean, we were taught that by the authority that it was a made-up disease by women seeking attention. So then what happens when a man has fibromyalgia or unexplained widespread pain? Where does he fall within that? You know, like, so that's injustice. That's injustice. And it contributes to our not believing people. There's medics still working today that were taught that in school. Here, this was in Southern California, up in Orange County, that probably still believe that. They've never been disavowed of that belief.
It's interesting, like when Joe told me that, I remember going to the World Congress on Pain in Glasgow. Was anyone at that meeting? No, I'm old. And I was in my first year graduate school, and these are the leading researchers in the world studying pain. And I was standing next to my poster, just trying to figure out what pain was. And this man came up to me, sort of a prominent, and he pointed to a poster and he said, "Fibromyalgia, it's all in your head." Right? Fast forward 7 years, I was on my residency at one of the top children's hospitals in the United States. And I was training as a psychology resident with psychiatry fellows. And they were talking about chronic pain as a DSM disorder, right? A psychiatric disorder, a somatoform conversion disorder. I bring that up not to just like say, oh my God, this is what is influencing every clinical encounter that our patients are having, right? And when we ask people, the flicker's not working, but I'm rolling, just rolling with it. You know, when I watch these videotapes, and I really wanted to show you some, but I'm too paranoid that someone could record, and I just can't take that chance. So I'm going to tell you a little bit about some of these stories to bring it to life. But I'm watching these clinical encounters of these kids going to the top tertiary level chronic pain programs, okay? So like, I know you're probably thinking like, I know Mel and Joe, we believe pain is real, like validation's important, But I think it's important what we're sharing because it's showing what our patients and people with lived experience are encountering, right? Even in the best Cadillac programs, right? And what do you notice when you see someone with pain and they come to see you? What happens in that 1 hour that you have with them? Anyone? What happens in that encounter?
Tell their story.
Pardon?
They tell their story.
They tell their story. I can't see who's saying that. You. Hi. Okay. I gotta walk around. They tell their story. So you're asking them about their story. What do you mean their story?
Journey, their story of how they got to this.
Their story of how they got to this pain. Okay. Anything else? I love that you're even asking. You're a minority. Yes.
Roller coaster of emotions.
Roller coaster of emotions. Tell me more, Joshua. Yes.
So as the patient's going through and sharing what their experiences are, sometimes they go back as far as childhood and talking about, whether they have a broken family, what their peer support was like, relationships with their siblings or extended members of their family. And there's a mixture of joy as they've found things that are beneficial for them and have helped them cope and manage. But there is also a fair bit of isolation, loneliness, and the sense that this is my lot in life and this will never change.
Ooh. Going back to childhood. Why do you want to go back to childhood?
Because sometimes pain starts in childhood, whether it was due to an injury, whether it was due to psychological trauma, combination of the two, or they've just been patterned to believe that, no pain, no gain, like we see in sports or in the military, and then people children specifically being told to be seen and not heard, which discourages them from sharing their experiences with parents, family, friends, and teachers.
Oh, I have chills. Number one, most people don't ask the journey period, okay? They don't. I'm watching these videotapes. This is like the best clinic in the US, okay? This physician who gave me these tapes is like my hero. Because most people don't want you to see what's happening. They don't ask about their life or who they were. Joshua, I love everything you're saying. Like, you just talked for 2 minutes, and I can tell so much about you. Culture, identity, self, how I was raised. What else? Emotions, yes, loss, grief, joy, humanity. Do you know what I hear in these videotapes? Tell me about your pain. Is it singing? Is it? Okay, is it over here? Is it here? Is it localized? Is it over here? It's like, not once does that person feel like their humanness is honored. You had your hand up very enthusiastically.
Yes, because not only am I asking for the whole story, not your list of diagnoses, all these things, the whole story. They then are telling me, and this breaks my heart, they're saying, I'm so sorry that I'm going on and on.
Why?
That tells me about every other clinical encounter that they've had.
Yeah.
And I tell them, I want this to be the space where you talk way more than I do, because I'm going to be listening. This is a safe space. I literally use the word valid and validation all the time. Starting off that clinical encounter, yes, I have this training. However, and this is where I'm hyper aware now of paternalism and turning the table and the power dynamics. You bring your lived experience, you bring your expertise on you and your pain, and together we're going to have shared meaning making. And I want you to explain this to me.
That's like master class, right? What do you hear in that, Joe? Here's the thing. If we want to, we've all we're picking up what we're putting down. they've been invalidated their whole life, not just in the clinical encounter. Guys, anyone in between like 35 and 55 in the room? Yeah. Were we allowed to encourage enthusiastically to express emotion? Right? It's not just about pain. I mean, if I was upset, like I'm locking myself in a bathroom. Like I work with veterans, Joshua. You say that, the culture, right? Everyone has a culture in and of itself. Like that matters. So it's not like, I'm sorry, I'm going on too much. I'm sorry. That is also part of generationally the culture, right? To not express suffering. I'm seeing Peter, suffering, not only pain, right? Suffering, identity. So when we think about what do we validate, it's a hell of a lot more than the sensation of pain. But what you did, Megan, that's so beautiful, is when you think about, and like, I don't have all day, but I wish I did. I would bring in things, okay, and show you and say, how do you look? What books are on your shelf? What's the room like? I mean, I do therapy now on a ranch with horses. Like, I've totally gone, because I actually think there's a lot of problems with, like, even the rooms that we have. How are we going to be the change? It has to feel, smell, look different. It has to energetically feel different. Do you know what the most powerful emotion is? It's not an emotion. Authenticity. So we're not going to do a workshop today about, like, just tell them you believe them. It's a car alarm, it's gone off, it's beeping, blah, 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 blah. But it's true. That's how I was taught. Like, that's enough. But what you did is totally flip the power. I got chills, dude. I want to go to you. You see? She flipped the power. Wear a queer jumpsuit. Have a pride flag on your, all these things, they're picking up. Because they're seeing, how are you going to be different than my mom and dad? I wasn't allowed to experience emotion. The military, a whole other, that's who I work with, right? And I see those men and women and people like actually breaking generational cycles and showing vulnerability. It's beautiful. So we have the power to do that, to flip it, to listen. Someone enthusiastically had their hand up.
So one of the things that, as I'm talking with pain communities, I'm hearing is that they're telling their story and getting shut down. They're telling their story and the doctor doesn't care. That's not important to them. That's not this. And then my response in communicating with them, and part of why I'm here this weekend, and maybe I can become the whipping post all of a sudden for saying, go to the provider that is the one for your need. If you need to talk about your pain, go to the person who talks about your pain. Don't go to the doctor who wants data points and is going to give you a pill. And so I've approached the chronic pain people with, go to who is treating that. If you can't lift your leg, go to somebody who can help you lift the leg. The doctor's not going to help it. The picture of that is not going to help that. Or maybe a better word is make the significant difference that you're looking for. And so maybe there's an element in here also of educating chronic pain people of who's the one that fixes.
Yeah. Are there any physicians in the room? Okay. I like you because you're here in a interactive workshop about validation. God damn, you have a lot of power. You all do. You know, when Joe and I met a bunch of times, I mean, to talk about the workshop, but also, she's my bestie. And, you know, like, you see, we're going to role play too, by the way. Oh, we're going to get our acting, like Oscar-winning acting skills on.
Awesome.
Yeah. Thank you. I hope so.
It will be.
Thank you. And you know, and you see these people coming back. And what is up with the adversarial approach? I'm not picking on physicians, by the way. We need physicians like you at workshops, interactive workshops on validation. But there's so many opportunities. Okay, so maybe I should ask, what is validation? Anyone want to, like, what is it? Maybe we should start there. What is it? What is validation?
Validation would be that the person sitting in front of you believes and knows that you comprehend
Yeah.
and can empathize and relate with their truth.
That's a beautiful definition. Their truth. Why do we listen to people? When you're in a clinical encounter with someone in pain, what are you listening for?
How to respond?
Okay, thank you for saying that, Stephanie. That's one way to listen. That's how we're trained, right? I'm trained as a psychologist. Okay, what's the diagnosis? So already I'm going in with a lens, right? Of like, what's the diagnosis? Is it anxiety? Is it pain? Is it this? I'm listening with that lens. There's also a different way of listening. Listening to understand. What were you going to say, Sherry?
Like your feelings and connecting with them and
Yeah?
showing them that you see them and you hear
Yes.
them and believe all of
Seen,
that.
heard,
It's
believed.
an energy thing almost,
Whew.
right?
Yes.
You're like, I get it.
Yeah.
Just,
Yeah.
It's not a lot of words.
Yeah.
It's the energy you're creating.
It's an energy, like all anyone wants is to be seen, heard, and believed. That's it. I saw this great meme of Oprah, and she's interviewed all these people, and they're like, what do people want? She's like, yeah, man, Beyonce comes in. You know, Beyonce's so confident. Oh, did I do a good job? People just want to be seen, heard, and believed, even Beyonce. But there's a third way, and this is a radical feminist way, which I'm really trying to practice. It's listening to respond or diagnose. That's how we've been trained, right? We only have an hour. Listen to understand. Listen to show up. But there is a way of listening to believe. And if you fundamentally check ourselves, right, and do what Megan did and flip the power and show them that we're flipping the power, that they are, and this is the justice, they are the knower and the holder of truth. And to validate someone doesn't mean you have to agree with them, but it's to communicate what you said. I can't see your name tag. Yeah, Sherry. Names are important to me. That's also validating. You know, when I go to a restaurant, I'm like, what's your name? Call people by name. But listening to believe. And as a researcher, and most of us are, whether you're a researcher or not, I think there's one here. This is nice too, sitting here. You want to. It's just better. I don't want to be on stage. Right? Isn't it better? Doesn't it feel better? That's another thing with validation, right? And don't worry, we're breaking into role plays, don't worry. What's your body language like? When I work with a kid, you're not a kid, but if you were, I get down, I look in someone's eyes. Right? I had a supervisor, don't Google me and out me. Oh my God, they're recording this. Never mind. I heard someone once who had a supervisor. And every time I went in her office, her laptop was on. Right? And she'd kind of be at her desk and I'm sitting here, right? Right then. Our body language can validate or not. And do you know what the number one thing you have to do to validate is? What's the baseline? Look in someone's eyes. What'd you say?
The eyes.
The eyes. Yeah. Did you ever tell someone something vulnerable and you could see them kind of well up a little bit?
people who do that, I just love. Like, they didn't have to say anything at all. They looked at me. They saw me. Right? So then I had another person who had a supervisor. And she'd shut off her computer. Ever go for dinner with someone and their phone is up and no, turn it down. Her desk was here, but she'd move her chair and she'd lean in. That's validating, right?
Kind of push the desk out of the way.
Even just that. And I mean, this seems so basic, but people don't do it. We don't do it with our own children. Joe, what have you noticed? Because you've seen provider after provider after provider. What are the little things that you've seen without even being told that made you feel like they're here with me? I'm seen, I'm heard.
So I think the person who actually I felt the most believed and the most validated by was actually my orthopedic surgeon, the surgeon who did my hip. Every time I went into that room, he would just sit, cross his legs, and ask me how I was doing. Just look me in the eyes. He didn't have my file, didn't have the computer open. And I always felt believed by him, but the one thing that I will never forget, there was a fellow that was training under him on how to do these hip surgeries that he did. And my x-rays were up on the wall in the exam room, and they're having a discussion about what the diagnosis is and what the possible treatment paths could be, including surgery. And the fellow looked at my surgeon and said, should she be in the room while they were having this discussion? And he looked at the fellow and said, it's her hip. Like, it seemed like such an obvious thing to both me and the surgeon, but just how interesting it was to me that the fellow was uncomfortable with me being in the room and having that discussion where there was uncertainty as to what the diagnosis and the right treatment path forward was. But it's so validating knowing that it's your body, my hip, but just being included in that conversation is incredibly validating. Like, what I thought mattered. And it should, because it is my friggin' hip. But that's one encounter, and I always talk about him because I always felt believed by him. And when I had surgery, and I still had pain after surgery. So the most visceral pain that I had, where it felt like gremlins were squeezing my organs, that was resolved with surgery. But I still had a great deal of pain after surgery. And my surgeon never once made me feel like I was to blame for that. He never got frustrated. Like, it was, I never felt like it was my fault that the surgery didn't work from him. I did from the system. The system very much blamed me for not getting better, the workers' compensation system. But in the room with him, never felt like it was my fault that my pain didn't go away after that surgery. And that really matters because there was a lot of other experiences that I had where if, X was the thing that was going to fix my pain and I did X to the nth degree, but it didn't work, I was always somehow made to feel like I was the failure for that. Like, I just didn't do it right. I didn't do the exercises right. So not a viable treatment path for people, but I went back to grad school after I medically retired to study human movement because I had those very biomechanical beliefs about pain. I thought if I could just understand movement just a little bit more than I already do, I could do it better and then my pain will go away. And I had the best form you could imagine. I mean, this is years in the making of me studying human movement just to move better so that my pain would get better. But that's not how it works. But so the most validating experiences I had. So I give big props to that orthopedic surgeon because they don't always get props for that kind of thing. But that's huge. I mean, just imagine people having those discussions without the person in the room about that person and how often that happens, or decisions are made for them and not with them.
And
And how
notice-
invalidating that is.
And notice that, right? Like, you can see when your colleagues, how they're talking about patients. So we're going to talk about empathy, a couple of things. We're going to talk about empathy. We are humans, and to empathize is vulnerable. Like, we don't talk enough about how we care for ourselves and our own healing journeys and how hard this work is, right? Because to empathize with someone and really show up, by definition, you have to tap into your own suffering. You do, right? Because if you're doing it on a cognitive, robotic level, it's not going to land with people with lived experience. It's not going to land, right? But the listening to believe, just to spend one more minute on that, you know, as researchers, we are trained in that way, right? It's the null hypothesis unless proven otherwise, right? Lawyers, prove it beyond a reasonable doubt, right? Prove it, prove it, prove it. So I work with someone with lived experience, Merrick. I love him. He wants to be a pain psychologist, and God damn it, I'm going to help him reach his dreams. And Merrick is awesome, and he's doing all this validation work. So we're coding these videotapes, and we're going to show you how to do this and the levels of validation. Spoiler alert, you can only nail it in validation if the person is vulnerable with you. You can't validate something if someone's not expressing their suffering. So they have to trust you. It's a big task. Like, this is overwhelming, right? You got an hour, okay? So you're going to rewrite decades of invalidation, right? But we are sort of trained not to assume truth. And I bring that up because I think sociologically and, you know, as a society, we need to acknowledge that. So this listening to believe, that's why it's radical. So we can all say, and everyone will say, I'm an empathic person, I care about, I believe people and all this stuff. But we also are in systems that have trained us to kind of like prove it, right? So when I asked Merrick, what do you want me to tell people today? Because he's watching these videotapes and it's hard. He's seeing the physician, kind of where communication breaks down and where it goes well, right? Which is what we're going to do today. I said, what do you want me to tell these clinicians? What an opportunity. And he's like, just be human. Stop making us overprove ourselves. And I had this lab meeting yesterday with two people of color, one from Ghana, one from Nigeria, and they were sharing their journey through academia. And the microaggressions and just how hard it is at having to prove themselves, overprove, right? So validation is a way to say, I'm listening to believe. This is baseline. And as Joe, as you were talking, I thought, God damn, the bar is low, right? Like someone just has to say, oh, it's her back. You can look at the pictures. So it feels like a daunting task to kind of rewrite things, but at the same time, it also shows how rare it is to just do that bare minimum of like repositioning power, like Megan said, right? And showing up and really showing, I believe you. You had your hand up while I get the video.
Yeah. So culturally, we're trained or conditioned to respond to other people's stories with, I understand.
Yep.
And that person who's had a traumatic brain injury is like, fuck you, no, you don't understand
Yes.
what I'm
Yeah.
going through.
Yep.
You don't get it.
Yeah.
You don't understand
Oof.
my lived fucking
Yeah.
experience.
Yes.
So,
I love that your
what's
brain is
it?
up.
I know I'm bad.
No, I love
No,
it.
it's perfect.
What is another
Yes.
way to say, I believe you?
Oh.
I believe you because people are like, yeah, no, you don't.
Yeah. Yeah.
Because, and some of it is the healthcare system trains TBI people.
Yeah.
You are so when our trauma experience of being excluded
Yeah.
is the same trauma experience of being excluded that the cancer client goes through.
Yeah.
That the kidney dialysis person goes
Mhm.
through, et cetera. It's the same emotions
Mm.
being pulled out. So how do we,
Yeah. Yeah.
one, stop training them that like, you are completely unlike anybody else, you're unique and you gotta deal
Right.
with that. And then also, how do we,
Mhm.
so how do we stop setting them up for that? And then also, when they talk to us,
Yeah.
how do we tell them, gotcha?
Yes. Oof. Thank you, Stephanie. Yeah. It's like, this can, to be like, I understand. Why do you think, like, a 50-year-old veteran who's been, like, deployed 20 times, who's had suicide attempts, and then I show up, full professor from the university, hair extensions, yeah, it's not real. But it looks good, right? But with privilege. Yeah. Yeah. But Stephanie, I can still connect. Why? Number one, it's okay. It's okay, buddy. We're friends. Why? Number one, authenticity. I don't understand. It's more validating to say, now, it's a good question. So, and it's segging into the video, which I'm going to show. Thank you. So, how do we do it, right? How do you empathize with someone? You have no idea what they've been through. I work with these guys, and I don't even ask them what happened. This is also radical. I don't need to. And within a half an hour, and I'm nervous every time. I'm like, oh God, because I know what they're thinking. And within a half an hour, boom, we are soul connected. So it's possible. But the last thing I would do is be like, oh, I'm a mom, I have kids, I get it. I've had PTSD. No. Authenticity. I don't get it. But you know what I do? Vulnerability. This is Brene Brown stuff. Yes, I'm showing you a Brene Brown video too. Like, I have to show vulnerability. Now, we're not trained to do that either, but if you don't show it, no one's going to trust you. So what do? This is just an example. I go in and I say, hey, I'm Melanie. I'm a single mom of triplets. Number one, they're like, okay, she's a hot mess. They like me. They like me because I'm not as cookie cutter. If I was like, I have a husband, he's a physician, no offense. They'd be like, oh, okay, and she lives in I know. I'm a single mom of triplets. That's my truth, right? The struggle is real. My dad, so these guys are in there, they're thinking I'm gonna like judge them. I know. My dad had a serious mental illness. And when I was your kid's age, in the 90s, when there was so much stigma, he changed his life. And he's my best friend to this day. And seeing him do that, when I struggle, I know there's an option. That's what you're doing for your kid. All of a sudden, that's my truth. Now, we were trained not to say anything personal, like I'm gonna be like a bobblehead caricature, university, everything's perfect. And that got me nowhere. But it can't be a gimmick, but you have to show vulnerability in some way or they're not gonna trust you because you can only validate when someone sees you as human too. So to answer your question, I never say, I know. I don't even tell them I've been through trauma. I don't do that. And I talk about that. I show them the video I'm about to show you about empathy. I have to tap into a time that I've been scared, angry, enraged, lost control. We've all felt those things, but we haven't been through the same thing. And it's validating to admit, I don't know, but you know what's invalidating? I can't imagine what you're going through. You're a superwoman. Stop. That's dehumanizing. To say, I don't know what you go through, but goddamn, it can't be easy. We're going to show you, and I want to use that example. But I bring that example up, and I'm not special at this. But the more I show up authentically, not trying to mask myself and be perfect, man, that fuels connection. It fuels connection. And if I can do it with them, we can do it with our people. And what Joe said when we met, Joe said, the person wouldn't be in your office if they didn't have a kernel of hope. Would they? They just wouldn't. Yeah. So never say you understand if you don't. And learning more about like anti-racism and anti-ableism stuff is really helpful, by the way, because you start showing up differently. So we got to do the work on our spare time, right? You should see my podcast list. It's not late. I don't watch Netflix. I want to show you a video before we take a break, and then we're getting right into the role plays and the how-to. Sound good, Joe? Sound good?
Yep.
Okay, so the critical ingredient to validate is to empathize. Anyone see this video? It is so good. You should show it to your clients and patients. What's the preferred term nowadays? People. Right? Yeah, exactly. Okay, so what is empathy? Anyone want to try? This is how I teach. My students hate me. What is empathy? What is it?
Sitting beside someone in their experience.
Where's the mic, Sarah? Look. I love your shoes. It's okay. You can take a break. You're a mama. You got your kid. You get to chill. What is empathy?
Sitting beside someone in their experience.
Sitting beside someone in their experience. Why didn't you say sitting with someone? I like what you said better, by the way.
I don't know.
Beside them.
I think there's a. I think with connotates that I know their experience.
Yeah. Beautiful. Anyone else? Empathy.
Giving space for that feeling, like that attunement and that matching them where they are, and like giving that space and not moving on too quickly.
Giving space for the attunement.
Yeah, like attuning, whoa, that's loud. attuning to that emotion, like getting in that vulnerable space with them, like you said, but then pausing and giving it space, because I feel like when you give the space, then the emotion comes out and you get so much more, rather than being, okay, and then my next question is, the more space there is, the more you get out of them and you understand better.
Pause. So you're probably going to ask, that's beautiful. Tori. Giving it space. So this is where I see it go wrong in the encounters. When the agenda, no one's listening to believe, no one's listening to understand, they're listening to, they already know what they're going to say. They got the spiel. Ever see that? They got the same spiel. We see lots of people like you. It's the same thing. They're not listening. So giving it space, this is where I see it go wrong. It's not enough to say, we should rename this like, it's not like, I believe you is not enough. That's what we should name it. It's not just about like, I believe your pain. Someone is telling you about their suffering. What do you validate? You validate vulnerability. You validate sharing. You validate what Joshua said, the totality of the person, the identity, the loss, the kid, how they grew up. You validate vulnerability. So providing the space, Tori, is so key because we don't see that in these encounters. And I know we got a lot to do, but they're not going to do the exercises if they don't like you. They're not. And if they don't feel like you see them. You know what else is validating? My therapist does it all the time. Yes, I'm in therapy. It's really good. I'm privileged that I can go. But now I've run through my insurance and I have to pay out of pocket. She thinks about me when I'm not there. She tells me that. Hey, Mel, I was thinking about what you said last time. She remembers shit that I said. That's validating. But giving the space, giving the pause. I saw a video of a kid who's admitting. See, everything seemed okay. Why am I don't have, drop the mic. Drop the mic. And anyway, the kid is just sitting there. I was telling Michael and Joe about this. And he seems fine, like everything's fine. And for the physical exam, the parents go in the other room with the physician. And then the physician comes back and says, I heard you've been feeling really sad. The kid's suicidal, right? And he says, yeah. And he starts crying. Right? But just subtle. But he's crying. No acknowledgement. Get through the suicidal assessment, check the muscles, give the spiel. This is a kid with pain, but you've just identified. Now, I know we can't open Pandora's box, and right, I get it. But goddamn, take a pause. Stop what you're doing. Keith Meldrum it. Put down the pen, right? And say, buddy, I know it's hard. Right? But she just zipped through. So Tori, taking the pause sounds so simple, but it's not done because we're not listening. We have an agenda. It's a busy clinical setting. We got to get out. We got the next patient. And if that clinician, I guarantee, and it haunts me. I don't know what happened to these kids. These tapes are 15 years old, and I think about this every day. Had she just stopped and acknowledge, because, pain education wasn't going to fix it. That's controversial. Okay, let's watch a video about empathy and then move into a break. Okay, what is empathy? Is it loud enough? No, that's a good one. Has anyone seen that one? You're gonna love it.
So what is empathy, and why is it very different from sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is...
It's okay.
Feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. at least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Now you're probably thinking, but I'm a physio, I'm a psychologist, like we have to do things. But in the absence, like I was trained, elicit the story when you first meet them, 15, 20 minutes, you know. But the story is unfolding, right? And yes, we need to do things, but it's like we should give equal, if not more weight to that holding of space. Like you're a passenger on their journey, you know? And something that I've learned from kids with lived experience, young adults, is that this sense of feeling abandoned, pawned off, you know, like sort of, is really psychologically damaging and socio-emotionally damaging. So we're gonna be the change, and in 15 minutes, you're gonna come back, we're gonna start with a role play, we're gonna do the how-to, and we're gonna get right into it. Joe, any questions, comments or any things to say before the break? Nope. Okay.
Is everyone who wishes to be in the room for the activity in the room? All right, so we're going to, I believe there are just a couple more slides, but we'll have to be quiet to hear the talk about them. Okay, excellent, thank you. So we'll get our fabulous speakers back up here and do just a couple more things and then break into our groups.
Well, is it even a coffee break if you don't spill coffee on your pants? But that's okay, it's real life. I'm messy. Relatable. Okay, I'm going to start with this video. It's a little funny. Has anyone seen it? A few people. It's so good, right? It's so good. What validation is and is not. So we have like an hour now. We're going to give some time for the people who are streaming in to ask questions and kind of engage with us too, because they're very important people. And what we're going to do, I'm going to show you this. Then we're going to break into a role play. Did that make anyone nervous? No, don't worry. We're going to do it first. So Joe and I then are going to show you 2 different clinical encounters. And it's going to be like an experiential exercise where you're going to just jot down. Is everyone a paper? You're going to like just jot down what you notice. Okay? And then we're going to seg into the how-to, and then we're going to break into groups, right? Where you're going to have a partner, and we're going to do this stuff. Like everyone, even you guys in the back. Even the people doing the camera stuff. Okay.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me.
Can we turn it up a bit? Yeah. Just give me the thumbs up when you're ready to roll. Okay. See? Smiling, not anxious, but I really am inside. Just faking it till I make it, you know?
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me. And I can just feel it, like literally feel it in my head. And it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail.
See, you're not listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like, there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you. Ow!
Come on, if you would just...
Don't.
So when I show that to the veterans that I work with, like the spouse in the heteronormative like couples, that like the spouses are like, oh my God, totally. And the guys are like, oh my God, totally. And I also show this to parents because it's so often, also supervisors who supervise younger people, it's sometimes so obvious what the person has to do, right? Like we want to jump into problem solving, but like holding the space. So I've seen this like 50,000 times. And as I was watching it just then, I was like, how would you validate someone when you know what their problem is? But that's in the like phenomenology of pain. We can never know. We can never know what it's like for someone. And what a cool, magical way to live in the world, to think of everyone's experience as to be with that beginner's curious mind, you know? And listening to believe. Okay, so I am Dr. Noel. I don't want to touch this thing. I'm so nervous. So we're just going to leave it like that, okay? Role plays can be cheesy, they can feel weird, and yet I find them very effective, okay? So I'm just gonna like ground myself, and we're gonna do 2 clinical encounters, okay? And all I want you to do is baseline level 1 validation. Pay attention. But just jot down whatever you notice, okay? I want to pretend I'm not a psychologist. This is the first time I'm seeing Joe, who has been living with pelvic pain for how long?
15 years.
15 years. And I'm in a clinic, and I do this day in, day out. I'm a full-time clinician, right? And she's coming to see me for the first time. Hi, Joe.
Hi.
How are you doing today?
I'm okay.
Good, good. I have not made it through your whole chart, so I'm gonna have to play a bit of catch up. But thanks for coming in. And I see that you were referred by Dr.
Hall?
Falcon. Dr. Hall?
Dr. Hall.
And he's
my primary care physician.
Primary care, right. Yeah, okay. So tell me about your pain, just to get me up to speed. Tell me about your pain.
So I have pain it's always on my right side, and it feels like there's gremlins like inside me squeezing my organs.
Okay. When you say squeezing, can you tell me more? What is that? Is it like stinging? Is it?
No, it's squeezing.
0 to 10, how much pain? 0 to 10?
You mean like right
Yeah,
now?
yeah.
Maybe like a 6.
Okay. Yeah. Is it always a 6?
No.
Okay. When is it not a 6?
When I wake up in the morning, it tends to be worse. And then throughout the day, it can get better. And then at night, it's worse again.
Do you work?
So I'm I have been working, but I've been off for like the last 3 months because the pain has just become unbearable.
So when you say unbearable, is that still a 6?
Well, sometimes it's a 6, but sometimes it's higher.
So you've had this pain for, I mean, like, how many years? Like
15.
15. So what changed in the last 3 months to not work anymore?
It's gotten so much worse.
Okay. What do you do for work?
I'm a firefighter.
That's pretty physically demanding.
Yeah.
Yeah. Okay. You married?
Yeah.
Okay. Kids?
No kids.
So tell me a bit more about your pain. You said it's like a squeezing. You haven't worked for the last 3 months. Like, tell me more about, do you have it other places of your body?
No. It's always just this sensation of my organs being squeezed.
Okay. Has it always been like that for 15 years?
For a long time, like it probably wasn't so much of the squeezing. I don't know.
Okay. What do you think caused the pain?
I don't know. I've seen internal medicine doctors, I've seen OBGYNs, I've seen allergists, I've seen a lot of different specialists, but no one can seem to tell me what it is.
Yeah, you've had a lot of tests. What has been helpful? I mean, like I mean, you've seen psychology, you've seen some good people. What didn't work, and why? Why do you think?
Well, nothing's worked so far. I'm not sure why.
Did you do what the doctors were saying? Like, did you?
I did everything. I did everything.
You did everything. What did you do?
So first, like I underwent all of the tests and everything like that. I've tried various medications. I did like different forms of birth control, but I never responded well to them.
Yeah.
Because they said that would help, but it never really helped. I've done exercise.
Did it help at all? When you say never, like did anything help a bit, even a bit?
Well, sometimes, like, if I would go to physical therapy or something like that, I could feel better for like a short period of time, but then it always got worse again.
Have you?
Like, nothing ever stuck, and none of the medications helped. I don't respond well to medications.
Well, medications don't really work for pain, so that doesn't surprise me. You know, oftentimes in physio, that it's common, you know, like we do the exercises, but then we don't really keep them up. Was that the case for you? Like,
No, I've always done them.
Do you do them still?
Yes.
Okay. So 3 months ago, you stopped working, but nothing's ever worked. Can you help me understand what changed?
I think it's all just become too much, and now when I'm at work, like everything I do is just so painful. I'm worried about being not just like a danger to myself, but a danger to my crew, a danger to the public. Like, my job requires me to be at my best to be able to do it, and I'm just not anymore, and I just can't do my job like I need to.
Do you have a history of anxiety or?
No.
These worries, oftentimes, I see this in women where they, you know, it's common, is what I'm saying. You know, the anxiety, the fear, and do you have, like, were you an anxious?
Nope.
You know, I see you've had some tests, but you've elected not to take certain tests?
Nope.
What are you hoping for?
At this point, not much.
Let's stop there. Okay, let's go away.
All angry again.
Gotta ask, did you disconnect from it as the provider because you noticed that the conversation went from engaging to like, fuck you, you're not in this, and I'm not gonna play your game anymore?
It's not intuitive for me to play, but it's funny, like when I hear people laugh, they are moments that I've seen, right? But let's do the debrief after. Okay, but I'm excited to do that. Okay, so just gotta ground ourselves. I'm gonna go behind the curtain, ground myself. Hi, Joe. Okay to shake your hand?
Yeah.
It's good to see you today.
Good to
Come
see
on
you
in.
too. Thanks.
I'm really glad that you came today. I've spent a lot of time reading through your chart because I know how exhausting it is to tell your story over and over and over again. Okay? So I don't want you to have to tell me the stuff that I can read here. Yeah? And I know you've seen a lot of people. I know it's been a hard, long road. Okay? I want to know who you are. And unless we know each other, what's the point, right? I want to help. So tell me, what brought you here today? Where did it all start?
So I think what brought me here today is I'm just really worried I'm not going to be able to get back to work. And to me, like, work is everything. It's all I want to do is be able to get back to being me again. I haven't felt like me for a really long time.
When you say me, it's like your identity, right? I read you're a firefighter.
Yeah.
Tell me about that. How'd you get into that? Like what? Tell me. It sounds like a big part of.
I took a different career path. I grew up in a family of firefighters, but they didn't want me to become a firefighter. So I went to college and graduate school, and then dropped out of graduate school to go to community college and become a firefighter.
Wow.
Because even with all that education, still kind of wanted to be a firefighter.
You just knew.
Yeah.
You just knew.
Yeah.
And went against the family grain.
Yeah. I had to move across country, though, from Detroit to California to do it.
Okay. So that tells me you're a persistent person.
I am.
It's amazing. I love that in a woman. So tell me, so you've been doing that and now you haven't been able to work the pain, right?
Yeah.
Yeah, tell me more about that. Where did that all start?
So I've always kind of had pain, even from when I was a teenager, but I never thought much of it, just thought it was kind of normal. But it's progressively gotten worse to the point now where I feel like it's hindering my ability to do my job, and I'm worried that I'm like endangering my crew, I'm endangering the public. I'm not able to do my job the way that I'm supposed to be able to do it.
Wow. I mean, it's a life-saving profession, right?
Yeah.
That makes sense. Makes sense you'd feel that. It's interesting you say like you've had this since you were a kid.
Yeah.
Probably
like 13.
And you're 32 now?
Yeah. I wish.
Shoot lower. Wow. It's interesting you say that, like as you say that, you say, I always had it, it's almost like what you're saying is like, that was the norm.
Yeah.
You didn't even know it was a thing.
Yeah, I didn't know it was going to get so much worse. Like it's like all consuming now. Like before I could ignore it and just go on with life, but now it's like so life limiting that it's so much more, I guess, like prevalent or noticeable than it used to be. It's just gotten worse. And I don't know why. I've seen a lot of people, but no one can tell me why.
You know, everyone is different. Everyone. I've heard people, you know, tell me it's almost like being washed away by the pain, right? Or it can be little waves and then it's all consuming. And that's what it's like for you. But living with this for so long, you're a firefighter. I mean, that tells me like you've withstood a lot of stuff, including pain, other things too.
Yeah.
Right? Yeah. Tell me more about sort of this shift and sort of like, you know, needing to sort of leave the firefighting. Because that sounds really important.
I'm just worried it's going to keep getting worse. Like, I mean, it's affected my ability to even just lift my leg to get on the fire engine, you know? Like, just like basic stuff is starting to deteriorate now that never did before. Like, I could always do those basic things before, and now I can't do those things anymore. So it's, I don't know what that means. Like, am I going to be able to get back to doing those things? Or is this it?
You know, that, like, thinking of the not knowing, right? I believe we can work together. I believe, like, what I'm learning from you is you are a persistent woman, right? And this has overcome. That shows me how intense and significant this is, right? The fact that you're here and how important. You're already telling me what is most important to you. It's the getting back to you, to your job. Yeah. Tell me, so I know you this is not your first rodeo. You've seen so many people. I don't want to do the things that haven't helped you, right? Tell me what hasn't worked. I want to know what hasn't worked, or the types of people you've worked with that are not helpful, right?
Yeah, I would say like nothing. I've done everything at this point. I think that's why it's so worrisome, because I don't know how to do any of those things any better to be able to get better.
Yeah. So it's not the things. Those people. What didn't work with those people?
I don't know.
Because if I'm honest, not everyone's doing a good job. What helps you in terms of a relationship? You know? What haven't you got from those people?
I don't know.
Yeah. You know, I'd love to learn more about your story, you know, like who you are and those experiences with those people, because, you know, the relationship really matters, right? And what has, we're not going to go down that route again, right? And I want to know you. I want you to know me so we can work together, right? Your pain, you've had this since you were a kid. You know, so many kids suffer in silence, right? What was it like? Like when you were growing up, like, could you talk to your parents? No. Tell me about that.
It just wasn't a part of growing up. You just walked it off.
Why?
I don't know. It was just how it was. And I don't know any different.
What's it like now sharing?
It's hard. I don't know. I don't know how to share what I'm going through.
You weren't taught. That makes sense, right? And it's interesting, you're 32, you You know, I'm 29. You know, we weren't raised. And here you are, bravely giving this a shot and sharing it with me. And I know that's hard, right? Just in like 10 minutes, I can tell you're a badass bitch.
I'm such a badass bitch.
Okay, we're gonna end there. We can keep going. I was kind of having role confusion, like, am I a physician, am I a psychologist, what am I? Doesn't matter. Joe, starting with you, it's a role play, I get it. What did you feel? Because we didn't talk about this. This wasn't like scripted. Yeah. How did that feel?
Uncomfortable. Try to forget that we're in front of a room full of people. I feel like especially the first encounter, and I probably in real life would have got mad sooner, or like shut down sooner than I did. Because like the repetitiveness of the questions and always going back to the same thing over and over again. And it's like, we covered, like, I don't know how to say it any different than the way that I'm saying it.
Yeah.
And to have to keep doing that is just so frustrating. And it's so common too.
Yeah. What's common? That approach of just being peppered?
Or like if what I'm saying doesn't make sense to that person, they just keep trying to get me to say it in a different way, but I don't have the capacity to say it in a different way.
And what is that
in that moment?
When someone does that, what are you thinking?
Like I want to get out of here.
Yeah.
That's what I'm thinking. I just don't want, it's hard to not feel like what you're saying is being understood by anybody. And when you don't have when you're in so much pain, you don't have the capacity to like creatively think of other ways of explaining what it is that you're going through.
Yeah.
To make someone else understand.
Yeah.
Like it would be so much better if someone just believed that that's what it was.
Yeah.
Go on.
Here's a person that's lived with pain for 15 years. Why do I have to ask what the pain feels like? Why do I have to ask about this is what I notice in the clinical encounter. They don't ask, who are you as a person? I already, in like 5 minutes, I know she's a tenacious woman, right? So when we're gonna go into like the levels of validation, knowing who someone is as a person is not only like, it's not only that it feels good, and it's what people want, and it's bringing humanity into healthcare. I can work with that. I know something about her. She's told me. I have suffered. I never said anything. I couldn't. I'm a freaking firefighter, man. And I can't work. This is serious. So taking that and knowing something about like who Joe is as a person, the validation is like, holy shit, this must be bad. That's what she wants to hear, right? Acknowledgement of like, this is, right?
Acknowledgement of the suck.
Acknowledgement of the suck. But also in relation to who you are, right?
Yeah, it's one of the things I don't think we explore or talk about enough. Like, I think the most distressing aspects of and this wasn't my real pain story or how it played out, but the not being able to work as a firefighter thing part is real. That disruption to your identity, and nobody ever talks about that. You know, like it never comes up. It's never explored, like how self-upending and life-upending pain can be, and when you can't do things that make you feel like yourself, you're not yourself, and that's so distressing.
and it never gets acknowledged.
And it's interesting when we think about like story, right? There's a beginning, a middle, an end. I don't, you know. So if we don't ask about who she is as a person before the pain, who was she as a kid? How does she identify? And you get to write the story, right? Then what do we have to work with? And that's what I find in the encounter. Oftentimes we're like really focused on, yeah, who are you right now? But what you're saying is, we need to see who were you before pain robbed you of this stuff. Because that's in you. That's you. I want to see your soul. Right? So it's not even enough to say like, who, you know, to say, oh yeah, oh you're a firefighter. She told me like who she was as a kid. She lived with pain. She didn't complain. Right? So then what do you validate? Stephanie.
Yeah, so I have a traumatic brain injury, and so I'm a little lost in the conversation here. Are we talking here on this bit about the first conversation?
Either, whatever. It's okay. Yep.
As far as organizing out where the complaint or the discontent was coming from?
Yeah.
Or the stress?
Yeah.
That would help me.
Yes.
Be able
Thank
to
you.
keep track of the other
Thank
things,
you.
Probably for others. To keep
Yeah.
track of,
Thank you.
oh, which ones were we talking about?
Yeah. Thank you, Stephanie. And thank you for sharing that. I'm neurodiverse. I have an autistic kid. I want this to be an anti-ableist space. So if anyone's feeling like I'm lost, Mel, bring me back. Thank you. We're talking about the first one. She's saying like that didn't feel good, right? And so we are also, Stephanie, like contrasting like, oh, but when we did it the right way, those were the differences. Thank you. What did anyone notice about the first invalidating encounter? Virginia. Oh, I need the mic, sorry. Doubt. Yes. Yes. She did. And that's common, isn't it? You've experienced that? Virginia, please share.
People online can't.
Virginia's a rock star.
To repeat, the word was doubt. That in the whole first interview, the clinician, Melanie, just doubted Joe's journey, what she was doing, what her pain.
Totally.
Everything. Doubt. And she picked up on it pretty fast. And you do when you build those walls.
Yeah, because I go to pain conferences and I got the people who are branding the interventions as being really effective because they do the RCTs that exclude a lot of people and a lot of comorbidities. And of course it should work. What did you do wrong? Did you adhere to the treatment? Did you believe? Did you behave? That's what we're saying. Go ahead. Being a bit controversial.
It felt like you were also, because I've seen this with clinicians who have a technique that they are going to employ on me.
Yeah.
So they're looking for me to say the thing that then they can go, my thing's gonna work.
Listening to respond, not listening to believe, not listening to understand. Listening to respond and sell you this fabulous intervention that I only know how to do.
Yeah. It was like you were looking for the exact word that you
And I've done this. By the way, I've done this, by the way. So like I'm not being judgy. But I'm on my journey where I can turn the mirror on myself. Like I've done that. I've done that. Where I'm listening and I've got it in mind, she's anxious. Oh, she's got an anxiety disorder. Oh, it's making the pain worse. Okay, I don't know how that works. She didn't do the exercises. No one does the exercise. Sorry, guys, no one does the exercises. And if they do for a bit, they stop. Yeah. I went to physio, but I love physio. Right? So what
I really did do all the exercises.
I know you did, babe.
In real life, I did every fucking exercise.
We're going to have to do a debrief. We're going to have to go to the ocean and smudge and wash this away. And repair our relationship. But when you are met with doubt, what do? Shut down. Usually before you shut down, you do something. Defensive. I'm going to prove. Over-prove. Yes, I did. Yeah, I did do it. Yeah, I did do it. Yeah. Right. That's why I brought up, like, I've been thinking about this. It's like, we are kind of trained to doubt. And I'm all for evidence-based medicine and psychology and like all that stuff, but it's sort of our method is not, that's why I'm into this radical liberatory listen to believe stuff. Because what's the harm? We're all in it because we want to help these people. Okay, what did you notice about, yeah, go ahead, Megan.
So two big things. One, you were in the first encounter technically using open-ended questions, but you had an agenda going the whole time. And so that's a big thing, like talking about motivational interviewing, like, yeah, I'm doing it, I'm using open-ended questions. Yeah. That agenda was being so driven, so that like really could hear that. And then
How'd you know? How'd you know? How do you know?
Yeah, just oh yeah, how did, and then like we were talking about, not actually listening to listen, listening for a response. Yeah, I'm gonna ask you the open-ended question, but it doesn't really matter what's coming out of your mouth because I already know, yeah, and then I'm gonna ask about that. And then the body language couldn't have been, that contrast was perfect because in the first it's legs crossed, sitting further back, looking down at my paper, versus the pen on the ground, paper on the ground, forward, all here. Couldn't have been more genuine. And watching Joe's body language in return. And so watching her body language shift as you're more closed off, she's getting more closed off versus, oh, now I'm gonna
like we're the best of friends. I call her my platonic soulmate, but anyways. I could see her melt. I could see her get a bit emotional. Like I could feel it. It's wild. You're gonna do this in about 10 minutes. It's wild. If you can just let yourself go, you can feel it. I did this role play, I think Tasha, you were there, with Stephen Linton, who did some work on validation. You know, he did the fear avoidance model of pain, that guy. And I was the person with pain. And I was a mother, and I had pelvic pain, and I couldn't play with my kids, and I just felt, right? And he did the same thing, the invalidating thing. But then we did the validate, and I'm at the world, and I was like, he just threw me into it blind, too. And I was like, oh my God, self-conscious. But at one point, when in the validating encounter, and it was only like 5 minutes, and he turned and he said, and I'm like, I can't play with my kids, like I do this and that. And at one point, it was beautifully timed. This is why you have to also bring authenticity, because you can't just say the words. And he said, you are a strong woman. And I started to cry. I don't live with chronic pain. That's how effective it can be. So when we think about, yeah, I know, that's why I'm on time, girl, I'm on time. It's communicating. So this is the stuff, anyone know what dialectical behavior therapy is? Marsha Linehan. Okay, it's for extreme emotion dysregulation. Validation works, not just for pain. Validation regulates emotions. So that melty feeling I had when he validated me in a role play, it actually serves to regulate emotion. Why do we do it? You know why we do it. If we don't do this, the judgment, could you feel the judgment? Right? It's like Brene Brown said, like perspective taking. I haven't lived with what she's lived with, but I am connecting. And in all honesty, do you know how I was connecting with Joe? You gotta connect on some level. I know what it's like to not be able to feel emotion. I know the pain of that in families. I can imagine as a woman what it's like to have pelvic pain. I don't have it, but I can imagine the double layers of misogyny and being disbelieved and all. So I'm drawing from some of that when I listen to her, and I'm tapping into some of my own pain. right? I don't give a shit if she did the exercises or not. It didn't work. But I'm also trying to establish I'm different. You need to feel that I'm different. We're going for the Keith Meldrum moment, guys. Okay, so these are the levels, okay? Joe, come on back up here. This is drawn from like the emotion regulation world, okay? The biosocial theory says this. Certain people come into the world with temperaments. I have one of them. I'm quick to dysregulate, and it takes me slower to come down. I see Tim Solomon's in the audience. If you need emergency CBT or DBT, he'll do it. That's a story for later around the fire. And so some of us are prone to dysregulation emotionally. There's nothing wrong with that. Some people are. I have triplets. I'm telling you, I have one kid like this. Now, my friend over here brought up a good point. What's your name? Fernando? Oh, beautiful name. I'm hearing ABBA in my head. And Fernando brought up a good point on the break. Well, what about people with neurodiversity? So, Stephanie, I'm not saying you're neurodiverse. You brought up, like, I have needs here. So, you're not going to look at my autistic kid in the eye like this and talk about emotions, okay? So I just want to preface this by saying you got to meet people where they're at. What's validating to one is not validating to the other, okay? So thank you for bringing that up. So for Jasper, if I'm playing Lego with him and not looking in his eyes, super validating, man. Share an interest. So I don't have enough time to go into all this stuff, but I just thank you for bringing that up because that's so important. So when you see me up here and I'm doing the Melanie thing, I'm not saying like that's how you should do it, right? Authenticity. Authenticity. So level 1, listen. How do we show people we're listening? How did I show Joe that I was listening? Attention, yeah.
I refuse to be distracted.
I'm just going to jump off the stage. I refuse to be distracted. What do you mean?
You didn't take notes. You leaned in closely. You did not look at your watch,
Nope.
your phone, your pager,
Yeah.
anything like that. You
Yeah.
made her the center of your existence.
Centered her. Centered her. And it's what Megan said. It's so beautiful. I had to say on the break, I was like, these people are amazing. Like we have an amazing baseline, right? Like when you were talking about how you center the patient, that they're the expert. That's the justice Joe was talking about. That's the justice. You are the expert. I believe you. And conveying that through our language. So number 1, on Monday morning, whatever, even in front of them, do this. Turn your phone over. Change the alignment of your room. Square to the person. But I love what you said, Joshua, which was like, it's like there's paying attention, but then there's flexibility. It's like, can I be diverted? I couldn't be diverted. I am telling, I'm good at this, guys. No, I am, but in my real life. But I had to learn it. I had to get medicated for ADHD, but now I'm really good. No, I'm serious. Neurodiversity. This is magic in interactions. When you look at someone and they know they're the only person in the room and you're listening. So number 1 of validation is saying nothing at all. Seems basic, but it's not. But it's foundational. Number 2. This is in the acknowledging. Don't worry about the language. It's fine. And I'll share all this stuff with you. If Joe started crying, now, oh God, I did this I think it was South Africa and somewhere. No, it was somewhere else, and someone's like, anyway, hold on. And you could pass her a tissue box. That's a controversial thing, apparently. Anyway, that's first. Or she's here. Or like there's a way to show nurturance. Like, can I get you a glass of water? Would you like a glass of water? But what you don't want to do when someone's showing vulnerability is show any sign that you're uncomfortable, that you want to move away from it. So if she showed some vulnerability, I might respond just by leaning in a bit more. Yeah. Right? I'm acknowledging. Ask questions. What did you notice about the role play, the validating? What did I ask her? What did I go in on? What did you notice about the differences between those two encounters? What I asked in this one versus that one? Anyone? I hate being on the stage. Do you?
Yeah, and you told me to come back.
I know,
up
I'm
here.
sorry. You want to go back down?
Yeah.
Okay. What did you notice? What was I asking? Because here's the thing. We don't think about this enough, but in any interaction when someone's talking to you, ask yourself, why are they telling me this? They're telling you it for a reason. She told me about her childhood for a reason. She was trying to say what to me?
This is how it affects my daily life.
Yeah.
How I leave things out. I'm talking to you about my lifestyle and
Yeah.
how my pain
Yeah.
has fucked up my
Yeah. Yeah. And let me tell you about my normal. I'm a strong kid. I never complained about pain. I'm a badass bitch who became a firefighter. She is too, by the way. Badass. Yes.
I was going to say, going back to what I was saying about sharing that lived experience, but then also that it breaks my heart when people feel they need to apologize to me. Oh, I'm going on, and I'll look at that. This is exactly what I want to hear. And I will say, you are telling me things, there is a reason.
Yes.
I want to be respectful.
We're at 20 minutes.
Yeah, no, we're good.
Another thing, Melanie, with that encounter was you started on the front end with Joe. We got to some pieces of the pain later. Joe was the front end of that property.
Joe, as the human, as the person, tell me about you. What a relief to say, I don't need to know all that shit. I was in a workshop this weekend. We don't ask that shit. I want to know you. I want you to know me. Okay, cool. Ask questions. 4, did you notice I said, God, that makes sense. You grew up like that. It must be heard. So contextualizing where they're at, that makes sense you'd feel like that. Of course, you fought hard to be a firefighter. Of course not being able to work would be, see what I mean? So the word, of course, that makes sense. Highest level, we're almost to the top. Normalize. Anyone would feel that way. If the thing that they fought for against their family, they couldn't do. I know people like that. And you know what? You got to sprinkle in a bit of hope. They got back, and you can too. I know it feels like you can't. You're telling me you're uncertain about the future. Of course you are. Who wouldn't be? Right? But I see people like that. So normalizing, that's tricky. You don't want to be like, oh, I see lots of people like you. That can, but of course that makes sense. This is the 6th level. There's no 7th. God damn, you're a strong woman. So the highest level of validation is when you can kind of wrap the person in the totality of the person. Say something about who they are. See? And that was what happened with Stephen when he did that role play. So these are the levels. I'm going to put up the thing as you're doing your role play now in 2 minutes. And just play with that. Play with your posture. Play with your listening. What are you asking about? So what you said, someone back there was like, you had an agenda. How did she know that? Because of what I was asking. What we ask tells us something about how we see them. Tell me more about when you were a kid. Versus, do you have anxiety? My question is telling you whether I have an agenda, what the agenda is. So ask questions about the person, right? How do you invalidate? don't pay attention. This is what I see all the time. Missed opportunities. And here's the cheat sheet. It's not rocket science, is it? But I'm telling you, once you get into the role play, you'll be like, it'll feel awkward and you're like, I don't know what to say, right? This is when someone shares something vulnerable and you just move on to the next question, right? So that little boy, I just like jumping off the stage. That little boy who it had come to light that he was suicidal. And he starts crying. He's got his tissue. And this was a kid whose dad used to hit him for being a little wimp, right? And that comes up. And he's showing vulnerability, even a single tear. And she's just going through the suicide risk assessment and moving on. No. Buddy, this is hard. I can see that. I can see that. Calling out emotion in the room is the most powerful thing you can do. We avoid it. Practice on your wives and husbands later. I do it on my kids. I don't have a husband or wife. But calling out like, did I make you uncomfortable? I don't want to say the wrong. Calling out emotion in the room. Missed opportunities, okay? Telling someone what they should or shouldn't feel. Kids tell me this all the time, and if we do it to kids, you're damn right we're doing it to adults, right? It's not so bad. So if we are conveying, like Joe was telling me, this is who I am. You were telling me, and this happens all the time with people with pain, I'm showing you how bad this is. But if I treat you in any way or respond to you in any way that kind of minimizes it or normalizes it, that's invalidating, right? Kick a person when they're down. Okay, we hope we're not going to get to those levels of invalidation. But I've seen it. One sec. I've seen it. In that case with that boy, the doctor, his mom decided not to go forward with a lumbar puncture and another test, and the doctor came down on the mom. Oh, you're letting him make his decisions? That's someone's alarm. So anyway, we're not going to do this. So please break into groups. 5 minutes as a person with lived experience, 5 minutes as the physician, and just try it. Yeah, and enjoy it. Okay. Yes, Stephanie.
Criticizing the behavior appropriate to the situation or inappropriate to the situation?
Criticizing someone when, like, it would be like, oh, Joe, you stopped working. You gave up. Of course it's appropriate. She couldn't work. It's a danger to other people. She's telling me that. Her pain is so bad. So that would be criticizing her choice to not, or her non-choice, like the fact that she can't work. Criticizing that. So just play. Just play with it. Okay.